move on. First of all, of course, what result of our webinar we will get. I think that we all hope to master how to make lips which our patients are admired. So we figure out how to analyze faces and morphology of lips, because I believe that it's important to achieve really good and natural looking results. Before injecting lips, we should analyze the faces, the proportions of the face, and we will see in our webinar why do that are important. Also recognize what makes lips look attractive and also natural, yes, because I don't know, please text, do your patient ask you for bump lips, or mostly they ask you about natural results? Because in my office, most my patients ask only about natural results to be safe and to really be in secret that she does something with her lips. So colleagues, could you please text, what about your patients? Natural. Victoria, thanks. Okay. Natural, Victoria, text me, and maybe more our colleagues also text. So the most patients want to be natural result, yes. And I also think that it's better result when, you know, when a woman comes to her office and every employee asks, oh, hi, had you your lips done? Had you injected your lips? I think it's not successful, yes, when everybody knows that you have done your lips. And this success is really when woman looks attractive, fresh, groomy, but nobody knows what procedures she has done except her cosmetologist. Do you agree? If yes, also text plus. I hope we have the same opinion on that question. Of course, master approach for difficult lips on our webinar, because really we have easy lips for injecting when we just put some volume in lips and get really excellent result. But sometimes we have difficult lips when you really don't know how to inject, what technique you should prefer. And today I will try to explain you, to show you on the practical topic how could we manage with this situation. And I hope it will be useful for you. So study anatomy of lips. Of course, anatomy is theoretical science, so we always should refresh it in our mind, keep the rings in our mind, what is safe and what is dangerous. And today we also through on the anatomy. Learn how to avoid side effects. It's always actual, and I will share with you information which I know about side effects and how to manage with different situations. And if you have really some questions or recommendations like life hacks, you could also text. It's interesting for all of us because we are doctors and we have the same aim to get result without any side effects. And discuss the process of lips aging, because really it's important to pay attention on the aging and really to treat it. I have also a webinar, definite webinar, lips aging special approach. Also very interesting because of scope of the information, and it's like definite topic. So also you're welcome to the webinar lips aging. And as usual, at the end we have the most interesting part, because in the practical we will manage with difficult lips, with different lip types. We will have 3 modules, and I'll show you how to inject, before injection, how to analyze the faces, and then how to inject different lip types. So I hope that webinar will be useful for you. We will spend time together with really interesting topics and get really useful information. So let's move on. And Thank you for typing. Thank you for your feedback. I see pluses, and I'm glad that you are active and answer me. Thank you. I appreciate this a lot. And colleagues, of course, for understanding each other, for understanding the techniques, how should we inject, we should know the names of different anatomical structures of the lips. If you know, it's great. If you don't know, please you could make a screen and just distinguish each part of lips. Look now. Let's look at upper lip, and look. It has Cupid's bow. Just in the central part of the upper lip, we have Cupid's bow. And you know, I would say you immediately that really with Cupid's bow, I work very seldom. Only in cases when it's flattered or there is no Cupid's bow in lips, so I inject a filler in this zone. In another cases, I never inject filler in Cupid's bow because it could lead to really unnatural result. Also, please, if you do the same, you also could text us to share with us your opinion. Then, just directly under the tip of nose, under the septum, we have philtrum. It's the area of upper lip, and it has columns, 2 columns of philtrum, and it's pretty nice when it has volume, when these structures we definitely see. And you know what I want to mention to you, that upper lip starts from the subnasal point here when the septum is, and ends in the closure line. And our lower lip starts before closure line and ends in the lip chin sulcus here. So our lips are not the only red skin, are not the only red vermilion border. Look, really our red lip is vermilion border. It has the border and vermilion mostly, and I will try to just a second. I will try to use my advice for showing you here vermilion border, and lower we have vermilion. So that's the part of lips with which we work. And here in the central part of upper lip we have the central tubercles. Also we could mention that it's perhelion. So also I never inject that zone, and I recommend you never also inject here, because also our lips consists like from 2 parts, from 2 symmetrical parts, and it's like 2 leaves, yes, and it's really pretty nice when we see directly, definitely, that upper lip and lower lip consists of 2 symmetrical leaves. And also what do we see here is contour, and look, the lower lip has the same, the 2 tubercles and the vermilion border. Also the commissures of the mouth, yes, the marionette lines, the nasolabial fold here, where is 13, and the smoker's line under our upper lip may appear, and also the smiles wrinkles and the lower in the lateral part of our mouth. So I think it's clear with structures, and now let's continue with the anatomy, with the conception of ideal lips, because really when we analyze the lips and try to figure out with approach, we should pay attention on lips. The perfect lips are when the height of upper lip a little bit less or equal to the height of the lower lip. Now we, of course, talk about Caucasians, but we will see later about also Asians and about Afro-Americans. The central and lateral tubercles of upper lip are not flat but have visual volume, and they are symmetrical. The lateral tubercles, the largest in the lower lip, yes, but you know, sometimes, or maybe in most times, they are equal in upper and lower lip. And also the commissures of lips have horizontal positions or have vertical direction a little bit, but not like, you know, Joker's smile, only light direction, vertical direction. And we see the contour of lips, especially in central part, where when it's Cupid's bow, it's a really accent. That's it about conception of ideal lips. But of course, everything is individual, so we should see definitely on the face and on the lips. And now, colleagues, something very important, it's our facial features. Of course, we could use it not even for lips injection, but also mostly for additional volume, for using fillers. So when our patient comes to us, we could make photo and to draw lines as you see in the photo. So you draw a line through hairline, then through the papillus line, and through the subnasal point and the tip of chin, and you get 3 sorts. Mostly they are equal. So it's useful when we, for example, want to put additional volume in chin. We see on 3 sorts. If yes, lower sort is longer than previous, so of course we should be careful with additional volume, because it also may lead to, such as, you know, carrot faces effect when our chin is excessively elongated. And also vertical lines. It's also useful when you want to analyze face, because you want to put a volume in cheekbones or temporal zone. You also draw lines, and you see that mostly the distances are equal. All distances between the vertical lines are equal on the face, and you see the asymmetry, yes or no, or a really additional volume, where could you put it. So let's move on. And now, colleagues, can I have your attention, please? It's very important in injecting the lips to pay your attention of the width of eyes settings. It's, I think, the most important and the first from what we should start. Look, if we draw a line through lateral iris border and just extending it to the mouth, if we get that the corners of the mouth are behind our line, so it's close set eyes, and we should be careful with additional volume in such case, because it would be unharmonic, and the additional volume may lead really to duck lips effect. Unlike another situation when the corners of mouth are before that line, and we have wide set eyes, so we really could make lips plumper, fuller, and it will fit to that face. And when we have situation when that lines are matched to each other, we also could use full lips, could create full lips, but really we also could take into account another facial features. So I think it's clear. Is it clear about eyes width? Colleagues, please type me. And now also very important is distance, to be more precisely two distances, from the tip of nose to the closure line, and from the closure line to the tip of chin. They corresponded to each other like 1/3 to 2/3. So also pay attention on this, because now it's very popular to increase the volume of chin, to put volume into upper lip, and really just notice that really it's important to pay attention on these zones. And thank you all for typing. Yes, it's really important for me. It's motivate me to continue and try to be interested for you. And also, colleagues, always pay attention to the profile projection of our patient, because when girl comes and asks me to inject her lips, of course she's herself in the mirror only in frontal point of view, yes. But of course, when we just analyze her profiles, we could recognize that there is a scope of work using fillers to really harmonize her profile. So when it's important, when we want to really inject a back of nose and a tip of chin, we pay attention on the nasal chin angle. The optimal measure is about 120 degrees. Of course, when you inject once, second, third, we should change that feature, change that measure. So also put attention, especially increasing the volume in the chin. And also I would mention that chin we could divide into two measures. The pagonion, here it's the soft tissues of our menton, of our chin, yes. And the menton is the apex of our chin. So chin has two measures, and we should understand about which one we talk about. Yes. So, and also the third point when we are planning to inject lips is nasolabial angle. Also very important. In women's faces, it's about 90 degrees. So pay attention on this when you put additional volume in upper lip, when you work with tip of nose, and even when you correct smoker's lines, yes, under upper lip. So also just take in account profile of your patient and the measure of that angle. It's very important. Oh, thank you for your feedback. Thank you for your activity. It's nice to see. And also I would like to share with you about lower third, because it's really very popular procedure to work with jaw angles. And you see that the optimal measure is about 110 degrees. And you know, with aging it decreases. So if we visual lead it to less amount, to less feature or figure, we will refresh the profile. But also pay attention of the natural measure, yes. Maybe not for every patient we should use the additional volume in jaw angles. And also one of my favorite procedures, because I see immediate result, it's the increasing of chin apex, because doing this we could really decrease the chin neck angle. Yes, you see it here. We could decrease that angle and make profile more fit, more fresh, and younger at all. So if proportions are not against, so you could really put an additional volume in that zone and really make profile more fit. Okay. And another one, it's like our reference point, the rickets line. Of course, it's also very, very important to pay attention on this. Look, if we connect the tip of nose and the tip of chin, we get line, and we could see how upper and lower lip corresponds to that line. In Caucasians profile, the upper lip and lower lies behind the line on 3-4 millimeters, and the lower lip behind 2 millimeters. You see that in Angelina's profile, it's almost touch the line, so a little bit disproportionate, but maybe it's because of her chin, but never mind, she's stunning also. And in Asians, lips almost touch the rickets line, and in Afro-Americans, the lips are behind that line. So we also should put attention that our lips, how do they look, depends on nationality, ethnicity, and of course of age, of different issues. And also Steiner line. If you, for example, used rickets line and it still be not clear what to do with lips, with profile, you also could use Steiner line, and it connecting the midpoint of the columella of the nose and the soft tissues of pagonium. So I have mentioned before that our chin has pagonium is here in frontal part of view, the soft tissues. So the lower lip should be 0.56 millimeters from this line. You could screen if you have not information and use it. And now, why do we use that? Because of different profiles, harmonized and unharmonized profiles. Look please, and really it's what I mentioned before when a young girl comes and asks to inject her lips, and we pay attention on her profile and see this situation or another this situation. Of course, first we should make a photo and just try to explain her that first he really should harmonize her profile, because full lips would not be attractive to her, would not fit her face until she would not have been done her profile. So you see, we could use additional volume in the back of nose, in the tip of nose, in upper, lower lip, and the tip of chin. And in such way, really, we could correct the profile and make it more attractive. And even in adult women, we could reset their youngness, putting additional volume in the tip of chin. Hi everyone, best wishes. We are continuing, and now we will pay attention on lips thickness. Also, it's important question, because sometimes girls come to me and ask, they have very thin lips, and they ask me to make their lips full, for example, yes, or very full, like Angelina Jolie has. So it's I could not do that, because I have not magic filler yet. And how about your patients? Does it happen with you when young girls ask you to fill their lips and make it fuller? So please text, and while you are texting now, I would tell you that really, if our patient has very thin lips, we could inject filler and make them thin, and after maybe second step, after second procedure, we could achieve medium volume of the lip. It could be great, and we will reach also the correct form of lip, because you see that to put additional volume, it's not a problem, but to achieve a natural result, a really excellent result, making the good form of lips, it's not so easy, and it's impossible. It's not impossible making from thin lips really full lips, but really from thin makes very full. We could, but in few steps. It will take time. Oh yes, thank you, Deborah. Thank you, Yud and Dr. Ahmed. Sorry if I have mistaken with your names, but thank you for listening. And also the same information, you could also see how it corresponds to the profile projection. I think we could go further. And now the field room forms, also very important, because to be honest, maybe a few years ago I injected the field room columns only on vertical directions. When they are flattered, so I just put my needle in vertical position and use the filler, inject the filler. But you know, when I recognized that there are different forms of field room and start injecting directly or definitely in the right direction, I really achieve more pronounced and longer results with it. So I also pay your attention that really recognize what forms of field room has your patient and inject definitely in right direction. And what's the next is teeth bite. Also very important issue, because if our patient has problems with teeth bite, we could not achieve the excellent result. Of course, even the best filler could not influence on the teeth bite, could not correct that issue. So we just ask our patient to smile, to grin, to clench his teeth, and we see the occlusion line. In normal position, there is full occlusion line, full occlusion of the teeth. And you know, it's not only about aesthetics, it's also about the rhythm or the speed of aging of the face. And also the nasolabial folds could appear because of teeth bite disorders. So if we see that problem, we should direct our patient to the orthodontist and to really make a deal with him and to co-work with him and get really excellent results, as we all of us prefer to have. And now also very important issue is Gummy Smile. So I even prepare you some information about studying. And you know, Gummy Smile in our terms, it's like excessive gingival disorder, yes? So we should pay attention on the dynamics of the muscle working, and always ask your patient to smile, to grin, to say something. When your patient talk about something, pay attention on your lips and your teeth and mouth, because there can be some asymmetry, some really unproportions. So I will tell you that there have been studies done to determine what people consider excessive gingival display. And in most cases, subjects rated smiles as attractive when 2 milliliters or less of gum tissue was exposed. And at around 3 millimeters or more, the smile was thought to be gummy. So if our patients have only 2 millimeters of gum tissues, yes, opened or showed, it's not a gummy smile, be calm. When more than 3 millimeters, we could really fix it. And how could it be fixed? First, one of methods, it's using of botulinum toxin. So we just inject the musculus levator labii superioris alequenasi, and we prevent the forceful lifting of the upper lip. How could we do that? We just ask our patient to lift the upper lip, not smile, but lift the upper lip. And here, when she does it, you just mark the apex of the trigeminum which appears, and you definitely inject a low dose of botulinum toxin in the apex of the triangulus which appears. So, and it's really a good measure to prevent gummy smile, but of course we should pay attention on the teeth bite and the disorders with orthodontists together. Okay, you see that celebrities solved that problem, and they are pretty nice without gummy smile. Okay, and now, colleagues, I will propose you to see on famous women who have really different thickness of the lips. For example, Angelina Jolie with thin lips. Look at her. Does she lose her attractiveness with thin lips? Please type if you think so, think the same, because I think really the full lips fit her more. And colleagues, while you typing, I will answer you why. Because of her face features. We should be honest that Angelina has really large features of her face. Especially look at her forehead. Yes, it's really quite high, long. Look at her distance from the iris border. Yes, as I mentioned you about eye setting. Look also on her lower third, on her chin and the jawline, jaw angles. They are all really large features, and of course, full lips suit her more. Okay, handle. Thank you. She lost attractiveness, not sexy. Yes, and you know when such patient. The woman with such type of face comes to you, you should propose her to inject her lips, because really it would be pretty nice and she would be really more attractive with full lips. Just analyze your face, because somebody really need her lips to be injected with additional volume. Yes. And now look at her profile. Something very interesting I want to say you now. Maybe you will be surprised, but our upper lip has, in ideal situation, has like curve from the subnasal point to the vermilion border. Look, Angelina has like springboard curve line, the upper lip like springboard on her face, like trampoline. Yes, so it's very attractive, and we should achieve that effect, or not spoil it if our patient has such effect, because it's really considered to be pretty nice. So here, please pay attention to the springboard on the upper lip form or shape. It's really what makes our lips be attractive. And another pretty woman, her features really fit to the canons of beauty, Irina Shayk. And look, without full lips, she also loses her attractiveness. So why? Why does she lose? Because of also face proportions. Because when we see lips on picture, they could be perfect, but on the definite face, different lip types, different form of lips, and different fullness of lips could fit different also. So really her chin, the line from the tip of nose to closure line, yes, and from closure line to the tip of chin. She has a long chin, and also she has, don't forget, Asian roots, and the full lips, it's like attribute for Asians. So really full lips suit to Asian face types. So you could accept it, keep it in account when Asian woman comes to you. Also analyze your proportions, and you could make her more attractive if you full her lips with additional volume also. Ricketts line is perfect. I think you see it. And now the next. Very sexy with her lips. Yes, exactly. Very sexy with full lips. But look at Cara Delevingne. Yes, it's also famous model. Very young, but very pretty. And look, with full lips. Does she lose her uniqueness? If yes, please type plus, because it's important for me to hear my opinion that yes, she is still pretty with full lips, but she loses her uniqueness. Thin lips fit her more, because she has, look, she has like heart-shaped face type. It's small face. Yes, she has small face, small mouth, small chin, and really full lips make her, I think, older or adult. Yes, not so uniqueness. And also what I want to say you about, about heart shaped face types. Pay attention on their jawline, because it's very often when that faces need just volume in the tip of chin, and when we put the volume, increase the tip of chin, the menton, yes, we make that face more fit, and really we harmonize the faces in such form. And so please, I recommend you to pay attention on this. It's very easy to achieve that result, fit and younger profile, but pay attention, because not the only lips we could inject. And the another important story is about thin lips. Look, if we want to contain thickness of the lips, yes, to contain lips in thin position, yes, we also could use fillers. It does not mean that we don't use filler. Of course we use, but softer, which gave just a kissable lips effect, not full or plump lips at all. And also pretty woman. I like to analyze really attractive faces. And the another one woman is Scarlett Johansson. Look at her chin. It is excessively elongated, yes, so she really looks attractive with full lips. And colleagues, now very interesting about Gwyneth Paltrow. Look, with plump lips, with full lips, she still be attractive, but look at her eyelids and at her eyes. You know that maybe you could be surprised, but the size of eye matches with the size of our lips, more or less. So you see that Gwyneth Paltrow has the sagging of upper eyelid. So she has small eyes, yes, as I could say so, and really thin lips suit her more. But you know, maybe your opinion would be different, so please also type. Handle, thank you. Yes, old and not fresh as we wish. And finally, let's pay our attention on the faces on which the proportions of lips are not corresponding to the proportions of the face. Yes, really you see before after. Yes, before increasing the volume, before decreasing the volume, and after. We see that really that women look more sexual, yes, but in real life it really could be weird to see such women. So we really could show our patients different photos, different celebrities, and to clarify, to identify what we should do to be satisfied both with result, patient and the doctor. And look, colleagues, finally, let's say a few words about Bella Hadid. Why? Because maybe a year ago, she was recognized as the most pretty one, one of the most pretty women in the world, according to one of the magazines. So I decided to analyze her face and see what I get. On profile, not profile, but on frontal part of view, everything is okay. Each proportions are corresponded to the features. Really, it's ideal. But look on her profile and to rickets line. We mentioned before that really upper lip should be shorter or smaller than lower lip. But look, in Bella's face, her upper lip are bigger and almost touch the rickets line. So I think her cosmetologist or her doctor should be careful with additional volume in upper lip, because really it could lead to duck lips effect. And look also at a nasolabial angle. It could be less than 90 degrees also. So I worry about her appearance, but really to Bella Hadid we could forgive for a lot. She's really beautiful, but really pay attention on your patients, and even celebrities has also be and in right position, in right arms of good specialists. Okay, colleagues, do you agree with this? If you agree, so please text yes. And also I want to remind you that we would have at the end of our webinar, we would have practical task with injecting of different lip types. I will show you the injecting for lifting the corner of the mouth, for lifting the different really difficult lips. So keep your attention. Handel, thank you. Deborah, Tiana, Yud, thank you again. So now we came to the anatomy. Of course, it's very important to pay attention on the anatomy each time. I had already visited the course, the cadaver course, and every theoretical anatomy courses I also visited, but each time when you open the atlas from anatomy, you pay attention on something new, or you refresh in your mind something which were forgotten. So let's consider that mostly our lips are inversion of the muscle, the inversion of orbicularis oris muscle. Why do I want to pay your attention on this? Because look, every expression muscle in our face, they network with each other. They really connect with each other. And if our patient has some disorders with dynamics, some asymmetry, or even gingival smile, we should treat. Yes, we want to treat. We should pay attention on all the muscles and should determine where each muscle spread and works. And for example, we have levators on our face, which corresponded to the mouth. It's levator labii superioris eloquenasi, and we injected it when we work with Gummy Smile. Also, we have the levator labii superioris, the muscle which we call zygomaticus minor, zygomaticus major, and the levator anguli superioris. So all those muscles are levators. And also, colleagues, just draw your attention that orbicularis oris consists of two parts, the labial part and marginal part. So, working with labial part here in contour, we could treat the smoker's lines. And working with marginal part, we could improve the form of lips when we have, you know, like clamped lips, very thin and clamped lips. So in such case, we just put the botulinum toxin in the marginal part of the orbicularis oris muscle, deep here, yes, when that part of muscles is spreaded and get like inversion of the lip. And after that, we could put additional volume. But it's advanced level, and maybe in some of my next webinars I will tell you about it. And also we have the depressors. First of all, the depressor anguli oris. We could work using botulinum toxin with the dropped corner of the mouth, yes, but not in the cases when the skin is dropped a lot, yes. And also the menton is the depressor, the depressor of the lower lip, the buccalis also depressor, and risorius is the muscle when the patient smiles and appear the lines, these smiling lines. You know, you also could use the botulinum toxin, superficial, subdermal, in this area and really treat the wrinkles. And also don't forget about platysma. Platysma is a very big muscle. It has superficial position just under our skin, and you know it starts from here and spreads even in some cases to the cheekbones. So it's a very huge and forceful depressor. And when we work with face, with botulinum toxin, we should pay attention on all depressors, and maybe even make full face correction by botulinum toxin. Okay. Thanks. I still thanking you for your feedback, because really it's important to me to be heard by you, you know. And now about blood vessels of the face. It's not new for you that really our face mostly supplies with the facial artery, and it is one of the branches from carotid external artery. And you know, when I want to work with needle on my face, on the face of the patient, I just ask him or her to clench her teeth, yes, clench her teeth, and I'll just palpate the frontal border of the masseter, and just put my finger and try to see or recognize the pulse of the facial artery. So if I catch it, I just mark it by my dermal marker, and you know, now after that we just imagine that the artery just goes to the corner of the mouth and gives the branches to the lower lip and to the upper lip. And those branches, they have like a connection with the couple branches from another side. Yes, they give collateralis, and also supplies the columella, the tip of nose, and after that the facial artery goes to the nose, to the alarms of the nose, and becomes the angular artery. So what is important to us injecting the lips, the layer on which the artery supplies the tissues. And also I would like to tell you some life hack. And you know, when you ask your patient, just give you his finger and you apply the finger of your patient just in position when the corner of the mouth matches with the nail cuticula of the finger, yes, and the part of the finger which is below this proportions, below this match, it's corresponded to the most dangerous zone, because in most faces it's like the region where the facial artery gives branches and bifurcate. So never work here with needle, and only cannula, and really be careful in this zone. Of course, there are individual features, individual signs, and some distinguishing with vessels, but we also could, like, you know, take a ring in our minds that that zone is the most dangerous. So you could also make a screen and we will move on. Okay, thank you, Karina. Thank you, Natalia and Alexander. And now I want to remind you that all questions I will try to answer them after our webinar in the end. And so please be free to type your question and I will answer it later. And now look, it's like slice of our lip. I think it's lower lip. Here we have hair, skin, yes, hair, skin, then vermilion border and mucosa. It's oral part of the lip. So look, really here we have muscle and glands, and all vessels are in a mucosa, a deep layer, or in our muscle. Only maybe the least, some not so large vessels we see in superficial layer. Even on that pictures they are absent. So that's the most safe layer for injecting our lips. This superficial layer, when we inject superficially, our needle not translucent, yes, we don't see the needle, but we recognize that we are superficial. So that's the layer for injecting, and it's mostly safe. But never keep your attention. In each cases, of course, you should be very careful with injecting by needle. And you know, also the one of the life hacks or recommendation or tips, if your patient in one time just feels the pain, excruciating pain, yes, acute pain, so it might be signs that really you injected in the vessel. So be careful and just draw your attention on this situation, maybe stop injection and see on dynamics. So colleagues, what do you think about the situation when it's painful? Is it dangerous to continue the procedure? If yes, also draw, also text please plus. And if you have your tip how to recognize if you're in artery, so also please text. It would be interesting to us to hear it. And finally, lips aging. Look please at Brigitte Bardot. She's also, I think, very stunning, one of the most beautiful women in the world in her days, yes. And look at her in different her age categories, and pay attention on the lips and perioral area. we see the aging of lips, yes, and we could really make like conclusion what happens with aging. Superficial wrinkles appear, elongation of the upper lip. The issue, of course, is the losing of skeleton tissue, yes, and we could really correct it with filler, yes. And flattening of the philtrum and cupid's bow. It's the case when we really could restore the cupid's bow, but maybe really we just should put attention on individual face. Decreasing of the convexity, thinning of the vermilion. And you know about vermilion, if you decided to make a contour, to inject a contour, also please, my advice, use the thin needle. The 30 gauge needle would be more comfortable for working, because really you should do it in a very, untraumatical way. Okay, decreasing of the descending of the lip corners, yes, and of course we could inject corners, could inject DAO, yes, muscle, but I just back one slide, but in that situation, in that case, it's too late, yes, because of, and even in that case, because of skin sagging, and we should work also with skin qualities. Descending thickness and elasticity, atrophy of adnexa, muscular activity, depressors are more forceful with aging, and decreasing of volume and decreasing in elasticity of orbicularis or oris muscle. So decreasing the volume. In aging women, we just should restore the volume which was before aging, yes, in young age, but not full the lips, because it would not be aesthetically pleasing in really adult face. And decreasing the elasticity of orbicularis oris muscle, we also could use even our renormalization, it's Hallow's drugs, to prevent the atrophy of tissues. And I also use such drugs, or hyaluronic acid with succinate, to work with upper lip in the area where smokers' wrinkles could appear. And now, colleagues, also very interesting, I would like you to hear that the start of lip aging depends on the professional and personal habits, of course, insulation, smoking, and also, last time ago I recognized that some exercises for the face, which some of my patients do, could also increase the chance of lips aging, because they make depressors more forceful. So please put your attention on the habits of your patients and help them to not make their aging speeder. Okay, also want to ask you, what do you think about the face yoga, about the exercises for expressions muscles? Do your patients do such exercises? What do you think about it? And also fullness of the face. Of course, we should keep our weight, especially when women start aging. It's important to keep weight and to be fit, to become fit before the really aging. The thickness of the skin, yes, the conditions of the dental jaw system. It's very important to keep our dental jaw system in healthy position, in consequences, yes. Depth of bite, really, it's important to manage with this in young age. height of the lower third of the face, yes, it's also related to the skeletal system, and time of the onset of menopause. So you know that we are doctors, and of course we should pay attention on all of those factors, and should direct our patient even to the another specialist, another doctors, if the patient needs really help and solving some problems related to his health. Okay, I don't recommend it. Yes, I also don't recommend it because, you know, I took part in one of it just to clarify, to recognize for myself what is this. It could be really useful, but in proper way, when we straight the depressors, when we really try to relax the depressors and to prevent some spasms, but to make our sphincters and even depressors more forceful, I think it's not a good idea. So also teach your patients to be clever, to be smart in this. And finally, of course, a few words about filler. I would be honest with you, Alexa filler really is my favorite filler for lips augmentation because of its comfortable working with this device, because of its safety, and because of natural results which I get each time. So I would say that really I use each concentration of the filler line, Alexa filler line, to work with lips. Smooth, it's about smoker's line, about refreshing lips. You know that when a girl wants to hydrate her lips, so I use Alexa Smooth. Or in such cases when you injected her lips before and she wants to refresh, so you could use Alexa Smooth and also just refresh her lips and get natural result. Alexa Medium is also for full lips, when full lips aging, or you just want also just reset the freshness, reset the youngness of the lips, you could use also Alexa Medium. But when the girl has thin lips or clamped lips, or we also have aging lips and they are thick, we want to manage with flattening, with philtrum, with dropped corners of the mouth, with also what else, with the contour. Of course, it's better to use more like descendant filler. It's Alexa Woman. And a few words about the producing of the filler. Of course, for me as for doctor, it's very important that the drug which I inject is safe for the health for my patients. So it's pretty nice that the company Hyaluronic has its own producing of the filler, and they just buy the hyaluronic acid like powder in Shiseido. And you know the category, the level of purification is very high. It's very good level in that plant, yes, in Shiseido plant. And then after getting that powder on producing, they put the PBS buffer system to dissolve this filler, to get the gel. Yes, after getting gel, they use the also titanium niobium knives, and it's very important that knives don't after that working, we have not heavy metals particles in filler. Of course, it's very important to get purified filler, which not lead to such a result, because of Of course, at least one time a year, our patient had injected the lips. So of course, the drug should be safe. And you see the wet setting of hydrogel particles. It's about the protrusion of the drug, protrusion of the filler. It's very comfortable and really easy in working. And some diagrams also about physiological pH. You know, it's important when the filler does not irritate the tissues, because if your filler has, for example, not physiological pH, so it's like more like acid, of course you put it in the tissues and it could irritate the tissues. Of course, each irritation, and especially long irritation, leads to inflammation. And inflammation, it's what we want to, you know, we don't want to receive the inflammation because of fibrosis. I would say you later about some cases. And also about display liquid formulation. If we put 1 milliliter of filler, we achieve result with 1 milliliter of filler, because some fillers could be really could lead to swelling, and I think nobody wants to get different size of lips depending on periods or something with when changes with health appears. So I think it's better really for the especially for you know, women who have the social position. They of course want to be sure that never their lips became larger than they have. So it's very important to achieve such result. And also about physiological, close to physiological values, osmolarity. It's also about swelling and about the case when filler don't push in himself the liquid, because when filler just you know contain from liquids, it brings from the tissues which spreads around the filler, and it could also lead to fibrosis. Finally, it's not physiological case. And finally, about non-inflammatory response, you see the Alexa fillers has the lower rate of inflammatory rates, inflammatory periods, recovery periods, because you see, I prefer to inject lips in untraumatical way, just maybe few injections, and that's it, to achieve really natural good results, and not traum the lips in really significant way, and it leads to short recovering period. So also when we say about the irritation of the lips by the filler, also it's important. Now, colleagues, I will tell you I will show you some cases about the fibrosis. And don't forget that we have the most interesting part. It's practical topic in the end. It will be very soon. I just show you some techniques and the fibrosis, and we will start the practical topic. So keep your attention and be calm. You receive very important information. Are you still there, colleagues? Please text me. Are you still in attention? How are you? How are you doing? So let's move on. Look, the fibrosis. There is my patient. She got her lips done somewhere few years ago, and she came to me and with such lips. I just made photo and see, nothing changes with the size of lips. A few years ago she injected and nothing changes with her size of lips, but maybe size satisfied her, but you see that lips have not definite form. It's not aesthetically pleasing, it's not really attractive, according to my opinion. If you agree, also please text. Thank you all for still in here. Thank you, colleagues. And another young, pretty girl, and you see what lips she has. Also, she had been injected a few years ago. Really large amount of the drug, of the filler, but look at closure line. It is waveness. It has waveness, so I suppose it's also fibrosis. And you know, lips really full, but the form of lips are absent. There is no really definitely clear form of lips. Form it what makes lips really attractive. So it's not easy to restore the form. Of course, I could remove the filler bar by hyaluronidase, but to restore the form, it's not too easy. It's difficult lips in working, and I recommend all my students and all my colleagues to use really soft fillers, which are safe, which you could really remove easily with hyaluronidase. And also I would like to tell you some words before that slide. I will tell you some words about Alexa fillers. Why do I prefer it? Because it have a lower rate of BDD. You know, BDD we use for link the hyaluronic acid to make a filler. And Hyaluronic has the lower rate level of BDD, but it's important because you could really easily remove the filler. Just put hyaluronidase, and after first application of hyaluronidase, you remove filler generally, so precisely. It's very important when you work with lips, you mostly use needles, and of course you should be sure that you are safe. And also what it's about, the important issue that the residual BDD could be in the syringe, in the filler, and it leads to inflammation, to toxic reactions, and to swelling also. And it's also important, I want to share with you that CHLOL companies, they checked each batch of the fillers on the appearance of residual BDD, and if they sure that it's absent, we get the batch of fillers. So it's also very important to recognize. And so also prolonged effect of filling the lips, it's not also healthy, because if our organism could not remove something in short terms, in few months, yes, so we try to like enclose itself from that drug, from that filler, and it leads to fibrosis. So fibrosis you could see on the photos, and I want to ask you, if you meet such patients, such lips, what do you prefer to do? Do you use collagenase or only remove the filler? And please type what do you think about such cases with really full lips but not aesthetically pleasing. Colleagues, now just a few slides about very important information about forms of upper lip, and we will really start the practical topic. And also, just I want to not forget about a special offer. The Halal company only today for listeners of our webinar propose us to some benefit. If you buy 3 fillers, you get 4th free. So it's good ability to use your knowledge in practice, to start practice, to try something new in your practice. And I recommend you to use that ability really to improve your knowledge, improve your approach, and really I think you will appreciate the result as well as your patient. So the forms of upper lip looks. It's so easy to remember, it's so easy to recognize, but it's very, very important, especially when we determine the technique for injecting the lips. M form, bow lips, very nice. We just should refresh that lips. Mostly I use Alexa medium filler for injecting such lips form. And maybe with aging, when the volume loses, I could really use Alexa volume in this case. The another one O form, the Parisian form, also pretty nice, but you could work also in technique as vertical injections and also achieve good results. And please take in account that forms, because later I will ask you about them. And the third form, I think it's the most difficult form. I call it seagull wing form of lips, because look, in the lateral parts of the upper lip it is clumped, and our aim is to reopen the upper lip. It could be not so easy, and maybe it's better to use both the botulinum toxin and filler in such case, and even cannula I use. But later I will see you my approach, and you also could compare with your techniques. And lower lip, the form of lower lip, you could make screen, because it's really very important. For example, rounded we correct by vertical injections. Oval we should do like we should do accent on lateral tubercles of upper lower lip, and here I recommend you to use a fan shape technique. Yes. Also flat lip, we also should reverse it, and it relates to thin, very thin lips. So maybe even cannula I recommend you to use just to inverse the lip. For inversing the lip, of course, it's better to put filler deeper, but it's dangerous, so I recommend you to use cannula if you are able. And I think that in webinar about aging lips, I show my students how manage with cannula. So maybe later we will see on my next webinar, and I will show you also. Triangular. Look, it's better to use also the fan shaped technique, like two fans. And also trapezoidal the same, 2 fans, and also we could put the boluses. Don't forget about boluses, because it relates to the proportions. If we just put boluses in the lateral tuberculus of upper and lower lips, we also contain the proportions. We never spoil lips. So it just, it's like tips for hydration of lips, because sometimes my patients ask me, just use hyaluronic acid, just use redermalization, or mesotherapy to refresh my lips, to hydrate the lips. Of course, I recommend them soft filler and just make 4 boluses, and we achieve more long-term result. And now, after that slide, I will show you the techniques. So be in attention, keep your attention. Look, it's also very important to analyze the corners of the mouth. Plus, if they are lifted, 0 if they have horizontal position, and minus when they are dropped. So when angles are dropped, I use first botulinum toxin if the reason is muscle activity, or also use the technique for lifting the corners. I will show you now, but before I show, I just want to explain. You inject upper corner, maybe under upper by few millimeters, make injection, and you go through the corner, through the commissure line, you go into the lower lip. Then on reverse, when you back, you put a little amount of filler, and then don't go through the skin, but make reverse and go to the upper lip and do the same. Put a little amount of material of drug. It's about maybe 0.1, 0.2, and then make a line and stop injection. So it's like, you know, Mona Lisa technique, and it also could give really very good results. I will show you now, not now, but after a few minutes. So now, colleagues, I would like to show you some techniques to managing with different lip types, and it's single wing. It's the most difficult lips, as I mentioned before. You just from commissure line, from commissure, you just make a fan-shaped injections, you see, and I prefer to do the same in Cupid's bow, from Cupid's bow, but of course analyze the face, analyze the lips before. Also vertical injection, it's Parisian technique. It's my favorite because when lips are full and you just want to reset them, reset their youthless and freshness, you just use such technique. 1 minute I made a pause to explain you something very important. When you inject through the contour of the lip, please go to the closure line. Don't stop before the closure line, and don't go further the closure line. Just achieve the closure line, and then when you back, you put the filler. And also don't make the injections so frequently. I make step about half of centimeter, and that's also works. And also for thin upper lip, it also may be about wing, single wing, or when we want to reopen upper lip, you could use also both the fan-shaped technique and vertical injections. Also, I just switch on the pause a few seconds. Colleagues, we mentioned about the ideal proportions of the lips, yes? And also pay your attention that if we want to reopen the upper lip, So we work in frontal point of view, yes. So we use vertical injections. If we want to make our upper lip more plump, yes, so we could use the boluses. So in such a way, when we use boluses, we just make it bigger in sagittal proportions, yes, in profile proportions. So use both techniques, vertical injections to make it higher, yes, to reopen it, and boluses to make it plumper, fuller in profile projection. I think, I hope it's clear to you. And now let's continue. Thank you, Stella. Thanks. That's what I mentioned before about boluses. Just pinch your lip where in the tuberculous. It's also pulse, don't worry. Pinch your lip where tuberculous, lateral tuberculous are situated, and go through the skin or definitely through red lip, yes, and just put an additional volume like boluses. So it could be maybe 0.1 to each boluses or 0.2. You should also pay attention on lip, of course. It's technique for refreshing, or when you just you know, like start up, just are going to start lips injection, you should try this technique. And this for lower lip technique, also about trapezoidal and triangular form, as I mentioned before. Also reach the closure line. It would be better when you will reach the closure line. Okay, single wing. Did we see single wing already? I think yes, we have already seen the single wing, and my presentation is here. So techniques we've done. Look, also a few techniques from this slide. As I mentioned before, I correct contour very seldom, only in definite cases, because I compare the cases in which I corrected contour and the cases in which I corrected only the vermilion border. The results were mostly the same. So why should I trim the lips of patient? Why should I spend more time for injection? Of course, it's unreasonable. So if your patient really needs the contour, use a very thin needle. 30 G would be acceptable. And look at this photo. It's very traumatical technique, so I try to avoid it, but sometimes it works. And also for this technique, use thin needle. As for, you know, as for regeneration, yes, not regeneration, but 30 gauge would be excellent for this technique. But in other cases, I don't think that it's a really good idea to trim the lips in such a way, because while you inject in one part of upper lip, and the previous part is swelling, and it's not also clear in which part you should inject an additional volume. Also, I would tell you some tips about the lips correction. It's off-label. It's only my recommendation, my own approach. When I inject lips, I leave a small amount of the drug in the syringe and sign the name of my patient, the date, and put it in a special refrigerator. Why? Because when swelling passed, we clarify what effect we achieved, and if we should correct some asymmetry, we have ability to do it. So also, if you have doubts about the asymmetry, also leave a small amount of the filler and be sure that everything would be okay. So thank you for your feedback. And Dr. Ahmed Jagrul does not need cannula anytime, does not use cannula anytime. You know, mostly I also don't use cannula, but in some cases I start to do that, and really I achieve really good results with when I working with very thin clumped lips. So I think you should try it. You should try it. You will achieve better results. And also, we have already mentioned about the techniques about boluses, so it's a good idea for doctors who just starts the injecting, and for the young patient who just want to refresh lips. It's a good idea to hydrate the lips. Why not? It's also very important. And I will show you some of my works. It's what I mentioned about thin lips. This is result after a few procedures. I think about after third procedure we get such results. So after first, of course, we just refreshed your lips, put additional volume, but we reach such result after third procedure. Also see the adult woman. She really she had been resetted her useness, because there is some doubt in my country. Adult women, their doubts about such procedures, so they think that it may lead to duck lips effect. She would be like, you know, sexual, but not so appearance as she wish. So I recommend of course, to use soft fillers such as Alexa Medium, and really achieve natural results. And also, colleagues, please. Okay, colleagues, I will remind you that I will answer the questions in a few minutes after practical topic. So please text your questions, and look, what is the type of that lips? Guess what lip types has that girl? Okay, while you type in, I will answer before you answer. It's O type, it's O form of the lips, and look, after the injection she became, of course, more attractive. And adult face, look, single wing, Alex, you are mistaken, but don't lose good mood. So the lifting of the corners of the mouth, you see, it's very good result, because we only used the filler, but in the technique, not the Mona Lisa, but you know, like reverse of the corner when you inject in the wrinkle, in the fold, and go through the corner, through the commissure line in the upper lip, and then make your needle mostly parallel, or even you know, higher in that direction. And when you back, you put the fill in this position. So in that case, I used such technique, and really it really works. Also, look, colleagues, it's a bow form of lips, very nice, very pretty, very attractive, and we just restore the volume, we just refresh the lips and get really natural good result. I think that the best result is when a woman looks attractive, grooming, but nobody knows about what injections he got done except her cosmetologist. So I think it's the result. That result is about what I mentioned. And also look, it's a young girl but dropped corners of the mouth. The issue is muscle, the dow. So we should also work with dow and also the teeth bite, because when there is small chin, small lower jaw, yes, jawline. So also the muscles try to restore the force, and we see the dropped corners of the mouth. And also about bow lips, you see, we just restore the volume, just make it more fresh. And all lips also, mostly I use the Alexa volume filler. Mostly I used it density, but it's pretty nice when you start feeling the lips. I recommend you to try Alexa medium filler, because it's so soft, it's so pleasant. And you know, colleagues, also when your patient comes to you and something is in her lips, some filler she has in her lips. She could not mention what definitely filler she had been injected, but you know that something is still be here. So I recommend you to use really Alexa, maybe medium, because it's evenly spread evenly, or even Alexa volume could be, because really our filler could be friendly to another because of its science, because of pH, because of irritation, yes, irritation, sorry, because of less of swellness. So in the cases, in the difficult cases, when you have doubts what preparat you should choose to still be safe, I recommend you to use really Alexa. And also, you know, when a patient has some disorders with her face, because with her health, because of course we inject only to healthy people, but when in the anamnesis she has really some disorders, but she recovered or has remission. So also use Alexa fillers, because also about swelling, about some science connects with filler appearing in tissues. I prefer using very mild, very safe filler to get really natural and good result, and it would not pay attention to her, you know, chronic disease. And also finally the seagull wing. Alex, it's for you. The seagull wing is now in the picture, and you see that we try to reopen that part of upper lip, try to lift it, not lift, sorry, to down it, to drop it, to put it on the closure line. And I used the vertical, not vertical, but fan shape technique, not from the corner of the mouth, but more medial. Here it was like fan technique. And of course here in the prohelion point I did not inject, and maybe I also injected in the columns of filter. Look, pay attention that when you inject columns, always pinch the skin, and in such a way you pressure the vessels, and it's more safe really to inject this zone, because it's dangerous because of vessels supply, yes, as you remember. And also it's I think it's all lips form. Adult woman, she has pretty pretty full lips, but with aging they lose their fullness, and we just restore their fullness. Of course, we reset the women's beauty. So I appreciate such results a lot, and also look, also pretty nice lips. It's a bow form of lips, and of course, restoring the volume, we make lips more attractive. It's obviously. And a young girl, she complains on asymmetry, but of course, when we treated her asymmetry and put additional volume just for refreshing, we achieve very successful result. Now you could see the result on young faces, because you know there are some doubts about also age, that young girls should not be injected by filler because it spoils their face. Sometimes yes, unfortunately, and I showed you before the photo on which really lips were unnatural. But when you use the right filler, the safe, the mild filler, you never spoil the lips. You just reset, girl. You make your self-confidence be on a high level, and I think it's a good idea. And also another one, you also see that we improved her appearance, not spoiled. Colleagues, now we finally arrive to the most interesting part of our webinar, the practical topic, and now I will switch on the video and show you different techniques on different lip types. But I propose you to be in touch and to keep in touch, and of course, if you have some questions about lips, you also could text me. Be free, and let's really be in touch. I want to remind you that Halal only today made a special offer for us, for listeners of that webinar, really, because when you just listen some webinar, some information, in few days at least, you will forget mostly everything, because you did not pay attention, you did not draw attention on the main things in practical part. And unlike the situation when you try to use new knowledges, you really increase your specialty approaches. So I recommend you to use this offer. You buy 3 syringes and 4th will be free for you, or if you buy 6, 2 will be free for you. So I think it's a good idea to try something new, and even if you have enough experience, you could try that filler and to recognize that it's really very, very good proposition, very good instrument in our arms. Yes, let's figure out with techniques. Yes. Wait a moment.
The first our patient is Mariana. Let's analyze the frontal projection of her face. Pay attention to the thirds. And you could see that lower third is shortened. Then pay attention to the eye settings. Mariana has close set eyes, so I recommend use additional volume only for refreshing her lips. And of course improving the shapes of lips. The next we analyze dynamic of her muscles. We ask Mariana to smile and to grin, we don't see gummy smile there or any asymmetry. Also pay attention to the bite teeth. We see prognotia. And now let's analyze the profile projection. First, pay attention to nasolabial angle. Its ideal measure is 90 degrees, or even more in women. So, if it's less than 90 degrees, be careful with additional volume in upper lip. It may cause to duck lip effects. Also, we see lips chin angle. We could improve its shape and make it smoother in that patient. And also the ratio between upper and lower lips. The proportions are corresponded. Lower lip a little bit below. And once more in full face, pay attention to the form of lips. It's not easy to correct them. The form is seagull's wing. You see the corners of the mouth are dropped. Also there is asymmetry. The upper lip in right is thicker. I suppose it caused by muscles activity.
And now we use the anesthesia, the application of cream. It really numbs the lips for at least 10 minutes, so it's enough for me to inject her lips. And what I used, the volume, I suppose, too, and you see she has really seagull wing form of lip. I use fan technique. I try to be superficial, and I determine the part of the lower lip on which I should work to make it thicker, so to make it full. So I do it by needle, but the same work you could do with cannula, but be more deeper. And also from the columns of philtrum, I put the vectors to the closure line and do the fan shape technique you see here. And also you could stretch the tissues. It could help you to be in right position, be superficial. Now lower lip, I just use vertical injections because really she has pretty nice lower lip, not clamped, so it's like Parisian technique. You could now see. The step, it's about a half of centimeter. And also keep in your mind that lips consists of two parts, of two lips, so make it symmetrical. And the columns on philtrum, as I mentioned you, I pinch the skin and then put the filler. And now try to lift the corner of the mouth. You could use this technique. Through the commissure line, go to the upper lip and then to the lower lip. But I just pay attention on the zone where it was not enough of volume. So you see, we achieve for a good result, and both me and my patient are satisfied with results. Pay your attention that she has close-set eyes, close-setting eyes. So we should not put additional volume in her lips because we should not achieve a natural result. So
the first our patient is Mariana.
And now I will see you second. In some we have 3 patients. So Let's continue.
Second model is Alex. Before lip injection, we analyze the face. Pay attention to the thirds. Upper third is from hairline to glabella. Middle third from glabella to the tip of nose, a little bit shortened. And lower third from the tip of nose to the tip of chin. You see it is shortened also, so if it would be necessary to increase the chin, we could do it, it would be harmoniously. Also pay attention on the width of lower third and the form of face. It is quadrangular, so it's better to use botulinum toxin working there than fillers. And now lips. Look, the lips are full. Alex has O form of lips, but the corners of mouth are dropped. And Alex is young girl, so we should highlight her beauty and use of her face. Now smile. We analyze dynamics. Ask her green. We see disorders with a teeth bite and even Gummy Smile, so we should direct her to the orthodontist, and could also use botulinum toxin to correct Gummy Smile, injecting musculus levator labii superioris aliquo nasi. But Alex's lips are not clamped, so we could put additional volume and the filler will spread evenly in tissues. And now profile. Look at angle. Nasolabial angle is more than 90 degrees, so it's good sign for increasing upper lip. Narration of lips. Upper lip is a little bit larger, and rickets line is almost perfect, but chin is clamped, so it's also the indication for botulinum toxin. And look, Cupid's arch and columns, they are saved. So I propose use soft filler for giving the effect of kissable lips and up the or lift the corners of mouth in technique Mona Lisa's technique. So we also see slight asymmetry, and I propose you to start injecting.
Cream for numb the lips. Do you do the same, colleagues? And I use Alexa medium in this case because the girl has really pretty nice lips, full lips. We just want to refresh. This is Parisian technique, vertical injections. You just inject superficial and mostly go to the closure line, as I mentioned before. So it's pretty easy. Stretch by your left hand, stretch the lip because it would be easier for you to inject the lips. And you see the step is half of centimeter. I don't go further than the central, than the Cupidon's bow. Don't go there, you see. And I don't do the contour because it will improve when the filler will spread, evenly spread, the contour will be improved. So the same technique is in lower lip, and the Mona Lisa's technique for lifting the dropping corners. You could see through commissure line, and then to upper lip also through commissure line, and when I back, I put the filler. So this is result. I think it's pretty nice, especially when we work with young face. We just should highlight its
before lip
beauty.
Injection, we analyze the face.
And the third one, technique, third one.
The third model is Alessia. First we analyze thirds. Upper from hairline to glabella, middle from glabella to the tip of nose, and lower is from tip of nose to the menton. We see now it is shortened, and Alessia has heart-shaped form of face. Now let's see at lips. We see that width of eye setting is corresponded to the width of mouth. So we could put an additional volume, but not in large amount, because of lower third, which is shortened, as you remember. The upper lip is a little bit clamped, so our task to make it higher, to open it, to refresh lips. Look, the corners of mouth are in vertical position, so we just could strengthen them, put in filler. And also look at lips chin sulcus. We could also make it smoother using filler. Now dynamics. Ask Alessia to smile and to grin. And we see bite teeth is in normal position. And profile analyzing. Nasolabial angle is more than 90 degrees, which is good for us. Why do I pay attention on this angle each time? Because if we lead it less than 90 degrees with injecting lips, it causes to duck lips effect. And also, when you treat the smoker's line, check the nasolabial angle to not decrease it much. Upper and lower lips are corresponded to each other. The tip of chin we could make longer and the lips chin sulcus smoother. So we will get a more harmonized profile. Now let's start working.
Short patients also numb the lips. It's pretty nice also a drug for numbing the lips. Hello, also the producer of that cream. If you have it in your country, you should try it. Very, very good numbing of the lips. And I use cannula. Oh, it's great to show you. You know, you also could inject definitely through the commissure line, but I did it laterally because because my cannula was too long, and I just tried to put my filler through the not so superficial, but both superficial and more deep in the upper lip. It's not hard or complete to do the same, but pay attention on the anesthetics. So you should really clarify the skin carefully, and very, very important to use good anesthetics. And don't touch the skin by your cannula while you are injecting. So I did the most pronounced part of the work. I inject volume deep in muscle. It could reverse the lips, because that patient, Alessia, she has really clamped lips. And you see also superficial and even in muscle. I put like a few vectors, and we analyzed her profile and decided to increase her chin, so it would be nicer, more nice, more beautiful. Yes, we just refreshed her jawline. It would be nice. And also, it's so important, it's so useful that you really so what we achieve What result did we achieve? You see, very natural, but really very nice. Also pay attention on the menton, and pay attention on, I hope you paid attention on her upper lip. So now I would like to answer your questions, and the company asked me to remind you about the special efforts. So really, when you want to buy the filler, you just think the now you think the link, and you could go on the link, through the link, yes, and to register and really get that special offer. I think it's really very important, and I recommend you to try it. In our chat you see the link, you could register and to receive all information which you are interested in, and especially about the offer, because it's only today for the listeners. And now, colleagues, I would like to answer your questions. Thank you that you were there to the end, and thank you for answering. I so appreciate that you are from the different countries, from the different corners of our Europe. Yes, even in many of countries I have not been before, but it's a pleasure for me that we were together on that webinar. And also I try to find the question. You could still be free to text me a question if you have. Okay. The webinar will be recorded. Yes, I think that yes, there is opportunity to hear once more. Thank you, Handel, for your appreciation. It's very important for me. Recording, yes. In Indonesia, oh, Roberto, hi, thank you. Okay, Istanbul, and really many countries. How can I measure? So it's very, Deborah Clay asked me about measuring. So when you make a photo of your patient, of course I think you do it before each procedures, and you just make photo, and in a profile projection and in frontal of you, and draw the lines, and you could use simple devices as we use in school, so it's really more useful, more comfortable when you make photo. Will we get certificate from this webinar? You know, for the link below you could ask any questions, so I think yes, of course, yes, about certificates. I hope that yes. And also about video, I answered you that you will receive the video. Thank you for answering about attractiveness, about different celebrities, and sound. Okay. Thank you, Natalia, about your good mark. Aspiration is not safe. Yes, really. You know, the Alexa fillers, syringes could also give you an opportunity to do the aspiration probe, but it's not the only sign, the only proper sign that you are safe. And we should be also ready to such situation when we have that side effect. I don't know about your country, whether you have hyaluronidase or another drug, but in Ukraine we have lidase and hyaluronidase. I use hyaluronidase. You know, thanks God, I never had ischemia in lips, and I just know the signs, the first signs, and want you only to pay attention on the signs. to be ready for such situation, to keep enough of hyaluronidase in your office, because it's the main measure to deal with, to manage with the ischemia. And of course, aspirate, we could aspirate, but it's too hard. Do it in lips, and you know that each time when we aspirate, we should feel feel our arms and just be restrict in the right position. So it's really very, very uncomfortable to aspirate, and I propose you really to make procedures shorter, and it will be more comfortable to your patient if you would aspirate each time, each injection, each vector. You will never achieve the good result, and your patient would feel the pain, and I think it's not a good idea. Of course, we should do the aspiration when we need it, but in lips it's too difficult, and I propose you to master the approach of using the cannula in danger zone. Okay, next. Next. Could not translate, maybe it's from Spain. Everything is great, thank you a lot, thank you again. Thank you, Handel. You are so it's so pleasant for me. You are so gentle. Thank you. Hope see you in my another webinars, because somebody asked me about webinars. Yes, I have. I think many another interesting webinars about facial proportions, also about aging lips, and about advanced webinar for advanced doctors who use fillers and botulinum toxin to harmonize the face. So I hope we will see on my another webinars, and it would be pleasant for me. I will prepare a scope of useful information. Is it with Botox or without? You know, the cases which I showed you were without Botox. But of course, with Botox, we could achieve better results in some cases. And if we will see a webinar corresponding to or relates to botulinum toxin, I will tell you. Yes, Dr. Ahmed, I think you satisfied with video, and okay, you just thank me, and she got after months heart knob. Should I treat with hyaluronidase? One pet. So Deborah Clay, you know, according to my understanding, your question that you treated the smoker's line and got one pet, so it's like the bump of the filler. If yes, so yes, you should treat it with hyaluronidase, but take a time, give a time after procedure. It should be at least 2 weeks, and if that side effect does not pass, so you should apply the hyaluronidase. But if I mistaken you, so you could text me in the social media or in Viber, and I will answer. Thank you, Yut. Thank you. Okay, and Dr. Ahmed Dergu, 0.1 filler in lip tubercle, especially in dull lips. Do you use bolus 1 milliliter to tubercle? Yes, exactly. I mostly use 0.1 milliliter to each tuberculous, each lateral tuberculous, in the upper lip, in the lower lips, and in some it will be 0.4. And then I could also use more laterally a little amount. The same technique, I use 0.05 milliliters more laterally in upper lip and in lower lip. And then you massage, and but Alexa filler could really spread evenly, and you achieve good result without any trauma, and the rehabilitation will be as shortest as it could be. So yes, that's a good idea. You catched everything. Thank you, Elisabetta. Thank you. Oh, colleagues, it's so pleasant for me that you appreciate that webinar. So I suppose that I have answered all of your questions. If no, you could really text me in social media, in Instagram or in Viber. Okay, colleagues, I hope I will see you on my another webinars, and I want to thank you for your interest, and want to also mention one idea which I also appreciate, that making women beautiful, we changed the world for the better. So I wish you success. I wish you have a nice day, and hope see you soon. Bye.